Shiver. I'm going to be your student nurse today. And first, can you tell me your name and date of birth? Okay. And do you have any allergies? No. Okay. Thank you. Today I'll be giving your wound care. I'll be getting rid of your old dressing and cleaning your wound and applying a new dressing. So we gave you pain medicine 35 minutes ago. Do you have? Can you rate your pain on a scale of 1 to 10? 1 being the lowest, 10 being the highest. A 1. Okay, that is good. So we can go ahead with the procedure. And so I'm going to want to wash my hands and apply privacy. So go ahead and then I'm going to want to set my supplies out. Get those ready. Red biohazard bag up. Just want to go ahead and drop the side rails and raise the height of the bed. Good working height. It's a good working height. And take this to the bed. Okay, alright, so I'm going to go ahead and pull the patient's gown up and exposing the wound and making sure to keep him covered except for only the wound spot. And I'm going to go ahead and I'm going to place this underneath him to try and stop any drainage or anything. If anything does, keep our sheets clean. Alright. Okay. I'm going to apply sterile gloves. Clean gloves. Okay. Now I'm going to take off the bandage and be sure to pull towards the wound and with hair and hold the skin down as I pull up so it doesn't pull the skin, and pull slowly towards the wound. So I'm going to pull the wound off, pull the bandage off, and I'm going to look at the bandage and note any drainage and the color of the drainage, the amount, and the smell of the drainage. So once I've done that, I'm going to fold it and I'm going to place it into the red biohazard bag. And then I'm going to take out any of the packing inside of the wound. Well, go ahead and I'll take out the packing, being sure not to touch the wound. If I can get it without touching it, I'll go ahead and take it out. But I don't want to touch the wound since I don't have sterile gloves on. Well, I'll wait on that because I'm going to run out sterile gloves, and because they look like they're really in there good. So I'll take the gloves off and throw those in the red biohazard bag and apply hand hygiene. Next, I'm going to want to go ahead and set up my supplies, my sterile field. So I'm going to go ahead and get my tape for the wound, get my tape for the bandage ready. have my tape set up. I'm going to go ahead and get my supplies ready and set out my sterile field. Pull this away. Throw this away. Okay. I can touch the outside because that is not going to be our working surface. Okay. So I want to pull it away from me. To the side. Only touching the outer edge because that is okay to contaminate. That's already contaminated. I won't need that space. So next I'm going to pull out my sterile gloves without touching the rest of the thing. I can touch the outside of the gloves. And pull out the wrapping because I won't need that for this procedure. Set this to the side. Pull out my tape because I already have tape. Set that to the side. Make sure I don't get over the top of my field. I'm working around the edges. So for next I'm going to apply sterile gloves. Already washed my hands from the last and applying sterile gloves. Now since this is contaminated this side, I'm going to want to work anything sterile on the other side of my sterile field there. So I'm going to put these on. Make sure to keep them sterile. Touching the outside of the glove. I have a little trouble getting these on, so I want to restart over and get a new pair. So I'm going to pull these off and get a new pair. Okay. I'll get another pair of sterile gloves, and so they restart sterile. And I'll open them up again, and these are a fresh pair of sterile gloves. Done this 100 times. These gloves are not cut really well. Okay. Alright, now on this side, because this one's sterile, I want to touch the inside of the cuff. Put my hand in the inside of that. Touch my other hand in. Only touching the inside. Make sure not to touch my clothing or anything. I'll do this, keep my hands clean. This is sterile, so I can throw that away. I can touch this and throw it away. Not putting my hands below my waist. Alright. Next I'm going to clean the inside. Well, now I can go ahead and touch this. Take that out, so I don't want to mess that up. Okay, dispose of that. Dispose of that, and I'm going to want to go ahead and clean it. Well, I didn't pour the sterile solution. So I would take off my gloves and put on and pour the sterile solution without sterile gloves. But for the sake of time, I'm going to go ahead and do this. And I pour sterile solution. I want to pour it over my working area. I'm going to pour from the side nearest, and don't get too close, but not too far away, and not spill. Pour a little sterile solution. Okay. All right. And this time I would put on sterile gloves again. because my hands will be contaminated. Now I'm going to want to grab my gauze, clean the edges, clean the wound. I'm going to work from least contaminated to wet my gauze, work from cleanest area, the area I want the cleanest, to the area that doesn't matter to us. So I'm starting the inside and wipe, and every time getting a new thing of gauze, wetting it moistly. Don't want it soaking wet, just a little wet. Every wipe, getting a new piece of gauze. The wound is clean. At this point, I'm going to want to look at the wound bed, note the color and the wound edges, note the color of the wound edges, and what the closure of the wound. Note the closure of the wound, and note the skin around the wound. Next, I will measure the wound. So I'll get my thing in here to measure it, cotton applicator, and I'll measure the top. Making sure not to touch the patient and losing sterility. Okay. And I'm going to place it over this. Place it over my measuring. 14 inches. And I'm going to want to measure from width. And I have 2.5 inches wide. I'll throw this away. And then I'm going to want to measure the depth. So I want to moist this so it doesn't stick to the patient. And find the deepest area and check the depth. Okay. And I got 2 centimeters on the depth. So get that away onto a red biohazard bag. Now I'm going to want to go ahead and pack the wound with it's a wet to dry wound, wet to dry wrap. So I'm going to want to pack it with a moisten our stuff, but you don't want it soaking wet. Moisten it and wring it out, and then I will fluff it up, place it inside of the wound, making sure not to touch the outside of the patient on the patient's skin, and be gentle. And do that with another piece. Fluffing it up. Placing it in there. Being sure not to keep sterility and not to touch the patient's outside. There we go. Okay. Next, I'm going to go ahead and put on my 404 gauze onto the patient, getting prepared to put the ABD pad on. So I'm going to place the 404 gauze on top of the patient's wound, and then I will get my ABD pad out. Putting the blue side up, I will place that over the top of the patient's wound, and then I can go ahead and take off my gloves. Took off my gloves and go ahead and apply hand hygiene, clean. And next I'm going to put on the tape. Tape it down, keep it secure, don't want to go anywhere. That is good, and I will put my pad. I'll check their discomfort level. So are you in any pain? Can you raise your pain on a scale of 1 to 10? 1 being the lowest, 10 being the highest. Okay. Patient says still at a 1, so we're good. But that's everything.